My name is Lexi from NTC. I'm a nursing student and I'm going to wash my hands, provide for privacy, and I'm going to introduce myself. So I'm Lexi, I'm a nursing student, and today I'm going to be doing an IV insertion on you. Could you tell me your name and date of birth? Marie Johnson, 12/12/1999. Alright, good, that matches up with the MAR. I can see we have an order for your IV insertion on here, and the reason for that is because we're going to be administering IV meds, okay? Good. Could you tell me if you have any allergies, Marie? No allergies? Okay. Good. Do you have, what is your non-dominant hand? Your right? Okay. Good. Your right arm, so we'll use that today. Have you ever had a fistula in that arm, or have you ever, no? Okay. Have you ever had a mastectomy in that side? No? Okay, good. So I'm going to assess for understanding to this patient to make sure that they understand. So I'd have them repeat the information as to what I told them. So they need to repeat what so what's going to happen in this procedure is I'm going to insert an IV, which will be a needle, into you, and then a plastic cannula is going to stay there. Then I'm going to hook that up to saline and then do a saline flush on you. Make sure the line's patent. Okay, so do you understand? Good. So then she repeats it back to me and she understands. So if she didn't understand, then I would have another nurse along with me. And if she was a pediatric patient, then I might have a smaller needle, and I would have their parent in the room. Okay, so next, now that we did that, is I'm going to ensure that we lift up to make sure that this is a towel underneath the insertion site. And then I'm going to ensure that my caps are nice and loose. And before I do that, I need to make sure that I use sterile technique, and I have my 5 milliliters in here. And I'm going to get all the air bubbles out of there. Good, so we have no air bubbles in there anymore. I'm going to put this back in here, make sure it's sterile in there. Good. Now I'm going to check the expiration date on their saline, and we are good for that. And next, I'm going to do the site. So with the tourniquet, you want it to be quick release. And then once you have your quick release knot, now you want to make sure you have a pulse. And this patient has a pulse, good. And then I want to check to make sure that I find my vein. So their extremity is dependent, and I can tell that I'm palpating and I can feel the vein right now. And to feel the vein better, you might want to put a warm compress for 5 minutes on the site. Okay, good. So now I'm going to release the tourniquet. You don't want the tourniquet on for more than 2 minutes. So next, what I'm going to do is I'm going to wash my hands, and then going to don my gloves. Now I'll apply my tourniquet. Make sure I can feel a pulse. And I can feel a pulse. So now I'm going to do circular motion inside to outside, and then I will allow that to dry. Then I will take my needle and going to make sure that I pull the skin taut, and 30 to 15 degree angle I'm going to go in. And then once I can see the red, the flash, I'm going to go down to be parallel just about, and then I'm going to insert another 1/2 centimeter. And then once I'm done with that, I'm going to insert the catheter all the way into the vein, to the vein site. And next, what I'm going to do is I'm going to retract the needle, and then I'm going to take off the tourniquet. Then I'm going to take my saline, and then I need to take off the cap, and using the sterile technique, I'm gonna go ahead, screw that on. Then I'm going to administer the saline. Then I'm going to make sure that there is no redness and there's no swelling at the site and that there's no pain. So I want to take this off. Saline. Next, I'm going to put on my bandage. Over the site, keeping it stable. And it goes over the pink part. Good, so I have it on there. And then what I want to do, make sure I'm nice and careful because I don't want to move the needle in the patient's arm. Good. So now I'm going to go ahead and put the date and the time and my initials on the bandage. Good. So next what I want to do is I want to tape, and the saline lock should be flushed at regular intervals per protocol when not in use. So I'm going to tape right here. You never want to tape the hub. And you can see that I'm going to close this off, being very careful because I do not want to move the needle in the patient. That does not feel good. Okay. Good. Now, what I want to do is I need to take off my gloves, and then I would wash my hands. And then I would make sure to dispose of my supplies. So I dispose of my supplies in the garbage, and I would dispose of my sharps in the sharps container. And then I would document my findings. So I would document the site of administration. I would document the start time. I would document the end time, document the date. I would document how the patient tolerated the procedure, the number of attempts of the procedure, I would document the gauge used for the needle, and then I would document what was administered, so 5 milliliters of normal saline. And then I would wash my hands, and then I would make sure that my patient is safe. So I could make sure that they're in a low locked position, that they tolerate the procedure very well, and that they're doing okay. And then I would wash my hands and I would leave the room.